Hi, I'm Dr. Amy Myers. I'm the founder and medical director of Austin Ultra Health, a functional medicine practice in Austin, Texas. Welcome to my blog. I'd like to first start by telling you my story, both personally and professionally, about how I got into functional medicine. I'm going to start off by telling you, as a child, I grew up with parents who were very into nutrition and health. My mother taught yoga. My father and mother jogged before that was ever cool back in the early 70s. And I ate homemade whole wheat bread, organic yogurt that we made at home. We grew sprouts, we had a garden, and I was vegetarian for the majority of my life, from age 14 until my mid or late 30s. So for all intents and purposes, I thought I knew about health and nutrition. After college, I joined the Peace Corps. I went down to Paraguay, South America. I taught rural farmers how to do organic gardening. I taught them about organic pesticides they could use, natural farming techniques, crop rotation. We actually grew and exported stevia off to Japan. And on my way down to Paraguay, I picked up a book by Dr. Andrew Weil and read that cover to cover. It was called Spontaneous Healing. It had just been released. And I decided that I really wanted to do natural medicine. I learned everything that there was down in the Peace Corps about health and nutrition that I could teach myself. I taught myself yoga. I started meditating, and I learned about herbs that the farmers and native Paraguayans used naturally to heal themselves when they were sick. I came back to the United States bound and determined to do some sort of natural medicine. I moved actually to Seattle. I'm from New Orleans. When I got back, looking at Bastyr, and thought perhaps that's what I would do, to go to naturopathic medical school, and realized that just wasn't the right fit for me. So I ended up going to allopathic or traditional medical school back in New Orleans. My mother had unfortunately been diagnosed with pancreatic cancer and passed away, and so I returned home to New Orleans and went to medical school. And in my second year of medical school, I started having panic attacks and tremors and insomnia and losing a lot of weight. And I was encouraged by one of my friends after a long period of time to finally go to the doctor, which I did. And they simply wrote it off and told me that it was second year medical school stress, and that I was figuring that I had every disease that we were studying. And I knew after surviving the Peace Corps and the death of my mother that that was simply not true. This was not stress, and that something really was wrong with me. So I demanded a workup, and about a week later, the doctor called me back and apologized and told me that I had an autoimmune disease and that I had something called Graves'. My thyroid was attacking itself, and it was overactive. You're probably familiar with underactive thyroid Hashimoto's. It's far more common, but what I had was causing my thyroid to be overactive. In medical school, I was the president of the complementary and alternative interest group. I did all my electives with alternative practitioners, and so like this, I was determined to treat this naturally. And I went to a Chinese practitioner and was eating fermented foods and more whole wheat bread and taking lots of nasty tasting herbs, and that didn't do anything. So I finally decided, after trying everything that I knew naturally and actually reaching back out to Andrew Weil, and that I would do the conventional route. So I begrudgingly took the medicine PTU, which stops your thyroid from making thyroid hormone, and I didn't feel very well on that, but I continued on, and about a month later, I was feeling really poorly on it. So I followed back up with my doctor, and it turns out that I was having something called toxic hepatitis. The medication can be very toxic on your system, and it was destroying my liver. And I was told that I needed to go get in bed and obviously stop taking the medicine immediately, and to lie in bed until I had recovered and my liver had recovered. And then I needed to make a decision whether I wanted to have my thyroid ablated, which is blown up with iodine, radioactive iodine, or if I wanted to have it surgically taken out. But those are my only two options. So not knowing where else to turn, and facing the fact that I might actually have to drop out of medical school, I was very depressed and scared and felt terribly. And at this point, getting off the medicine, my thyroid was very, very overactive. And I was having to eat, whole wheat bread. I was eating Ezekiel bread with butter on it, organic butter, before I went to bed every night, just not to wake up and lose 2 more pounds. So I eventually decided to have my thyroid ablated. And that was a whole roller coaster that I won't get into, of how long it really took for me to get that sorted out. And you can read some of my previous blogs about thyroid and the management of thyroid, and how most doctors aren't really doing that effectively by not looking at the full picture. So that, again, was a real roller coaster. And I, again, was bound and determined to follow my passion of natural medicine. In my 4th year of medical school, went and spent a month with Andrew Weil at his integrative program out in Tucson, Arizona. And at the time was applying to residency, and I applied to to family medicine and emergency medicine. I figured that if I never found out what I wanted to do, I could do international health, which is something that had appealed to me by working in the Peace Corps. So I spent a month with Andrew Weil, and it was an amazing experience, learning all different types of modalities. But for me, I realized it really didn't get to the root of what was going on, and I wanted more. So I actually canceled all my applications for family medicine, and I opted to go into emergency medicine, figuring again that if I never found what I was looking for, I could at least do international health. So I went ahead and applied to emergency medicine programs and ended up going through that residency, and that's was a whole nother ball of wax and very difficult to get through with this whole mindset of natural medicine and what I ultimately wanted to do, which is what I am doing right now, but didn't know it existed. I graduated from residency and went and worked in an emergency room here in Austin, Texas, in a pediatric ER as well as the main trauma center. And then after 2 years was decided to kind of get back into what had really brought me into medicine in the first place, this holistic approach to medicine. And so I went up to a integrative medicine conference, and I met Mark Hyman there. I heard him speak for the first time about functional medicine, which is really getting down to the root of what's going on, seeing the whole body as one, and looking for the root cause of one's problems rather than just treating symptoms with disease. And when I heard that approach, and knowing that there was really science to back it up and laboratory tests, I realized that that was exactly what I was looking for and what I knew intuitively existed but didn't know where to find it. So after hearing him speak, I went up and talked to him and asked if I could shadow him in his clinic, which he kindly allowed me to do. And from there I dove in and took all the training through the Institute of Functional Medicine, and today continue to do training with them. It's an ever-evolving field, and since we're all individuals and no two people are alike, it's a constant learning curve. And so now I have my clinic, a functional medicine clinic here in Austin, Texas, and I have a nutritionist on staff and fully believe that food is medicine. And I realized for me in going through this whole process that though I thought I was eating healthfully, being a vegetarian for 27 years and eating this whole wheat bread and homemade yogurt, that I actually was eating all the wrong things for me. And I personally have switched over to a more paleo diet where I actually do eat some lean animal protein, lots of fruits and vegetables, and some nuts and seeds. And so those were the right things for me to eat. And what we guide you here at Austin Ultra Health is what is the right thing for you to eat, and what is the root cause that got you in the boat that you're in. Certainly if it's an autoimmune disease, I believe that gluten is a problem for you, if not perhaps all grains, but we could get into that later. So I just really wanted to share my story with you and tell you a little bit about me. This is the first of my video blogs. I hope you enjoy it, and I'm open to any suggestions. I'm hoping that every Tuesday and Friday I'll be posting a video blog. Every Wednesday, Brianne, my nutritionist, will be posting a recipe. And then on Thursdays, I write for Mind, Body, Green, and we'll be posting a regular blog there that I'll also post on my blog. So I'm hoping almost every day that there'll be something on the blog, and am open to any suggestions of what you want to hear about, whether you prefer the written blogs or you like the video blog. And if the video blogs are going well, I'm actually considering doing just a free teleconference every month on a particular subject. So please like me on Facebook. My clinic is Austin Ultra Health, but it's listed under Amy Myers, MD. Include any comments below in the comments section. Love to have any feedback about the video or any videos that you would like to see in the future, any topics that you'd like covered. Same thing on Facebook. I'm very, very active on Facebook. I'll answer your questions, respond to your posts, and most importantly, I want this to be information to help people. That's really my guiding light here, is how I've been helped by functional medicine and how I see it change people's lives every day in my clinic. And I understand that everybody can't get on a plane and come to Austin, and I only see 4 or 5 patients a day, so that's really limiting. And so I really want to reach more people and let them know that there is a choice out there rather than conventional medicine. There are other choices. I unfortunately didn't get that choice when I was going through my autoimmune disease and my Graves' disease. So it is my gift to you to offer those choices to you before you have to go through such drastic, non-reversing procedures like I had to go through. So I hope you enjoy, and please pass on this video to anybody that you think would be helped by it. And you can see my clinic at austinultrahealth.com. My blog is dramymyers.com. And then I'm on Facebook, Twitter, Pinterest, LinkedIn, everything under Amy Myers MD. And that's AMYMYERS MD. Thanks so much.